When the Martin Luther King Jr Center for Public Health opened its doors in 2011, it immediately became a shining star in the South LA community. Dr. Jonathan Fielding, director of the Department of Public Health, will discuss the services available at this extraordinary state-of-the-art facility, including its emphasis on disease prevention and healthy living, things that should make us all feel good. Hello, everyone. Welcome to My County, the show that explores programs and services provided to you by the County of Los Angeles. I'm Stacy Galandi. Now, my guest today in studio is Dr. Jonathan Fielding, the Director of Public Health and the Health Officer for LA County. Welcome, Dr. Fielding.
Thank you, Stacy. Glad to be here.
Thank you so much. Now, this Martin Luther King Jr Center, this is the first time in decades that this facility has gotten some medical attention. Why is that?
Well, we had a facility called the South Health Center. It had serious problems with air handling, with air conditioning and heating. It was too small, it was cramped, it wasn't very welcoming. Time was overdue for a new center, especially because we have the most problems of any area of Los Angeles County in this SPA 6, which is the area about 1 million people covered where the center is this Martin Luther King facility.
Now, you mentioned SPA 6, this particular community. What does that mean?
It's not a hot tub.
I know.
The SPA is a service planning area, and SPA 6 includes a lot of cities, Linwood, Compton, Paramount, and some of the unincorporated areas of Los Angeles County, Florence, Firestone, Willowbrook, as well as parts of Los Angeles City. And it's about 1 million people. That's about 2/3 Latino, about 1/3 African American, and it's the area that's had the fewest resources in terms of health of any area in Los Angeles County.
So this health center serves all of those people.
Exactly,
1 million. Mm-hmm.
Exactly.
What are the main health issues when you're talking about these communities?
Well, the major problem in these communities are epidemic of overweight and obesity, high rates of diabetes, of cardiovascular disease, high problems of arthritis, asthma, and unfortunately just higher rates of many diseases than many other parts of the counties.
This first phase of this renovation, is that serving and dealing specifically with those health issues?
There's two things that we do. One is we provide some direct services. We provide services for sexually transmitted diseases, for tuberculosis, and limited basis for immunizations. But we're also working with the community. We're helping people get enrolled in Healthy Way LA, which is a new health plan. We are helping people get access to other healthcare services. But we're also working with communities to deal with the schools, with the faith-based organizations, with businesses, with other senior centers and the like, to help them look at a community level at what we can do collectively to prevent disease and improve health, as well as to improve emergency preparedness, because unfortunately disasters happen.
So this health center is sort of the hub for all of this. Is there like one-stop shopping
Exactly.
for all of this?
This is the hub, and it's a beautiful facility. It's a very welcoming facility. When people come in there, they're going to really feel this is a first-class facility, and that's really what the people in this area deserve.
So take me on a tour. For somebody who actually walks through the doors of the Martin Luther King Jr Center, what will they see? What will they find? What will be available to them?
Well, there's a welcoming area, and nice seating areas, waiting areas. There's a number of clinical rooms. There's a clinical section. There's a section for meetings. There's a section for health education, which is really important. And there's a big community room which can be, provided to community organizations so they can have really fairly large meetings there. And in fact, with louvered doors that open up so you can have kind of an indoor-outdoor space, it's very welcoming.
I'm curious, just in terms from what it was before to now, what would you say is the biggest makeover improvement in terms of services?
I would say this was not a small change. This is a full-body transplant. This is a much larger facility, a much nicer facility. It allows us to be central, and it also is part of a larger campus, because there are other facilities that are part of this Martin Luther King Jr campus. There's going to be the new hospital, there's an ambulatory care center, there are a bunch of other things.
Perhaps? Mm-hmm.
Well, some of that is already underway, but it's part of an overall master plan. It's the first piece of a larger plan, so this community is going to really get first-rate service in every aspect.
What can members of these communities expect now and in the future when it comes to their health needs?
Well, I think they can expect that it's going to be easier for many of them to get into a health plan, even if they don't have, a health plan. They didn't have a health plan to start with, and they were coming episodically. We're trying to focus more on primary care and making sure everybody has a medical home. We're also making sure that some of these broader community issues are being addressed. What do we do with the schools, for example, to increase physical activity, to change the kind of food that's being served? Trying to get people out and exercising, to make sure the community is safe, it's a place to recreate.
It's coming from all angles.
It's got to come from all angles, got to get all segments of the community. Public health can't do it alone, but with the right partners, there's nothing we can't do.
I hear you. I'm curious, you mentioned this earlier too, but what are the best ways that the community can feel ready in terms of emergency preparedness?
If you go on our website, there's a whole set of things you have to get together in order to make sure that you're prepared for any kind of emergency. It gives you that information.
The list
gives
right
you
there.
information with the list. Also a family communication plan. What happens if your phones aren't working? Where would you meet family members and the like? It also gives you a sense of how important it is to have community resiliency, to be supportive of your neighbors, to feel that kind of support, to know each other well, to know your neighborhood, to feel more neighborhood. When I was growing up, neighborhoods were really strong. Now it's time for us to get together and feel more supported, more integrated as part of our communities. That's the strongest way to be ready to prepare and to recover from any kind of disaster, whether it be natural or man-made.
I just have to wrap you up, but before we do, I want to mention you have a very long and distinguished career in public health, certainly in LA County. I'm curious, what improvements have you seen in the area of public health here in LA County?
Well, there have been huge improvements. There's a lot of reduction in smoking. We're now down probably below 14%, which is still 1 million people and still too many, but that's leading to reductions in cardiovascular disease and lung cancer and emphysema and the like. We've seen a reduction in cardiovascular disease, a really striking reduction, a reduction in the frequency of stroke. But on the other hand, we've seen an increase in overweight and obesity and concomitant problems of diabetes and kidney problems and eye problems and a lot of things. So we've seen a lot of progress. There's still a lot of progress to be made, both in communicable disease and in non-communicable disease, and that's why public health has to be there.
Well, if there's any man who can handle it, it's you.
Thank you.
Dr. Fielding, thank you so much for joining us today.
My pleasure,
Appreciate all of the
Stacey.
wonderful information that you've provided. But if you would like more information, you can go to the website publichealth.lacounty.gov. Please join us again right here on My County and learn more about programs and services brought to you by the County of Los Angeles. I'm Stacey Galandi. We'll see you next time.